Hello, nice to meet you. I'm Dr. Son Yoo-sok from Pleasure Plastic Surgery. Recently, there's been a bit of a trend in rhinoplasty. In my opinion, while there are still people who prefer very glamorous and high nose, there's also a growing number of people who want a much more natural look to the point where it's not obvious at all that they've had surgery. It feels like this trend is becoming somewhat polarized, and at the extreme end of natural-looking, unnoticeable rhinoplasty is, in a way, what we call closed rhinoplasty. In English, it's called closed rhinoplasty. The difference between open and closed, or open and non-open rhinoplasty, is whether or not you can see a scar on the columella, the column in the middle of the nose. So in a way, you might think that with closed rhinoplasty, nothing is opened at all, but actually, while there's no scar on the columella, some incisions are still made inside the nose. Of course, since that's not easily visible from the outside, we simply refer to it as closed rhinoplasty. So in fact, recently, many people who prefer a natural style have been coming to our clinic, and there have been a lot of patients visiting specifically for this type of closed rhinoplasty. So then, to what extent can we achieve improvement through closed rhinoplasty? I think this is something many people are curious about. Generally, it is known that open rhinoplasty is more effective and can deliver more definite results. Of course, that is also true. However, in some cases, closed rhinoplasty can also yield sufficiently good results. So today, I'd like to explain that aspect. First of all, one example is when the area you want to improve on your nose is focused on the tip. Of course, it's also entirely possible to raise the bridge of the nose or smooth out a hump. But for those who want to correct a bulbous nose, closed rhinoplasty can be very effective. And among those, if your nose tip is very low, you may need to build up the nasal column to make it more prominent. But for people who already have some height at the tip and want to make it a bit higher while refining the shape, especially those who want to improve a bulbous nose closed rhinoplasty, is extremely effective. So how do we achieve improvement with closed rhinoplasty? We make incisions only inside the nose like this. There is cartilage at the tip of the nose called the alar cartilage. We remove some of the excess tissue from the alar cartilage. Then we carefully gather the cartilage to create the desired shape. So for people whose nasal tip cartilage is more developed and larger, the results tend to be even better. Next, if necessary, we use the tissue that was removed earlier or harvest ear cartilage to further raise the tip of the nose. So sometimes we perform layered grafts to elevate the nasal tip cartilage, or we place a columellar strut in the middle of the nose to create a stronger support for the nasal tip. Through these methods, we can shape the tip of the nose and naturally enhance its height. People with a drooping nasal tip, often called a hooked nose, or those with a slightly short nose, can also see significant improvement through closed rhinoplasty. At our clinic, I usually mention this during consultations. If I determine that you can achieve sufficient results with a closed approach, those who proceed with surgery based on this assessment are in fact extremely satisfied. So among those considering rhinoplasty, if you want to focus more on correcting a bulbous nasal tip, I think it would be good to consider this type of surgery.
What would you say to people who absolutely want a closed approach because they dislike scars?
Well, actually, even with that, there are varying degrees to consider. There are definitely cases where an open approach is absolutely necessary. Of course, even among revision surgeries, if you only need to slightly raise the nasal tip, if the tissue is soft enough to allow for dissection, or if you just need to lower the columella a bit, these simpler procedures can be done with a closed approach, and I actually perform a lot of those myself. However, if it's a revision surgery that requires significant changes, or if there's some contracture, or if the tissue adhesion is severe in those cases, an open approach is definitely necessary. Even if it's not a revision surgery, if you need to significantly raise the tip of the nose or make major improvements to the nasolabial angle, then an open approach would generally be better. However, if the patient absolutely insists on a closed approach, I explain to them to what extent that's possible with a closed technique. That way, it makes it easier for you to make a choice. If you're curious about these aspects, it's best to come in for a consultation and hear the explanation in person.